Joining me now is Dr. Margaret Harris, a spokesperson for the World Health Organization. Doctor, thank you for joining us today.
Thank you. Thank you very much for having me, Roger.
What's your response to the fact that some fuel is getting in? Is that enough?
It's not enough. It's a good sign. I can only say a good start. It's not nearly enough, not nearly what we need. We need 120,000 per day at least, but a lot more than that just to get things going again. Absolutely everything stopped, as you know, and we're particularly concerned about the sewage systems not working, obviously the hospitals not being able to have any fuel to continue their life-saving work, and the water systems, the desalination systems not working. So all the things that you need to keep the basic public health functions going are not going at the moment.
And that obviously raising concerns about disease outbreak, things like cholera.
Absolutely. We are really concerned. We're already seeing a large rise in reports of diarrhea. Now, the laboratory systems aren't working, so we can't even tell you what the causes of that is, but we know that's coming from polluted water and from people being very, very close together and being unable to wash their food, their hands, etc. And we've got cases that are in the sort of 40s, 50,000s when we'd expect to see about 2,000 cases. A lot of those cases are in children. And remember, these are people who are starving, who are dehydrated, who are terrified. Their mental health they're under enormous stress. They haven't slept for 5 weeks, so their immune systems will be tremendously weak. So the rates of death from disease will only skyrocket as these diseases take hold.
When you hear those numbers, I mean, obviously concerning. Is there a point though where you simply say it's out of control? How do you get it back under control at that point when it comes to the diseases?
Well, it really is out of control now because there is nothing that any of the health support system can do right now because there's no food, there's no water, there's no power, and there are fewer and fewer hospital beds. We've gone from 3,500 hospital beds to possibly 1,000, but really they're operating mostly as first aid stations and they're dealing with huge numbers of seriously injured people. So all the other things you normally do to stop an outbreak, to deal with people who have these infectious diseases, simply can't be done right now.
If there were a ceasefire call today, how long would it take to get things not to normal, but just even to get it under control and start helping people?
Certainly, it means we could, especially if we were allowed to get the power and the medical supplies in right away. And those medical supplies are piled up on the other side of the border. We really want to get them in as quickly as possible. If we could get the people, the power, the supplies in, it could make a huge difference very, very quickly.
Dr. Margaret Harris, the spokesperson for the WHO, thank you very much for joining us this morning.
Thank you very much for having me.